One of the many boons of modern Uganda has been an increase in life expectancy. The number of Ugandans living past 60 years increased from 1.4 million in 2015 to 2.2 million in 2022. This rise in longevity should ideally be accompanied by an improvement in one's quality of life with regard to access to good healthcare, income, and nutrition. Unfortunately, by the time many reach this age, their quality of life may not be what it once was.
Omuntu okkaluubirira obulamu oyinza okuba nga tolina ssente noga nti oba nnaaliridde kino awo okaluubirirwa naye awo sirina kukaluubirirwa kiyinza kuyaza amaanya mukama kitone kye yampa.
A study conducted by Dr. Joy Gumichiriza Onoria among 380 elderly persons in Nansana and Busukuma town councils in Wakiso district showed that majority had poor quality of life and negative perception towards aging.
Quality of life is varied. So you can have the health-related quality of life, where you look at not just absence of ill health or presence of good health, but having more or less comprehensive health profile. Then we can have the physical quality of life or the social quality of life. Social quality of life is your day-to-day interaction with other people, your family, your friends, your neighbors, what you do in your free time. That is your social quality of life.
The study, an association of quality of life and aging perceptions among community-dwelling older adults in Uganda, was published in the Journal of Gerontology and Geriatric Medicine.
So the study, we aimed at looking at the quality of life and perceptions of aging for elderly individuals residing in a community setting. Because we came from the background that in perceptions or how we perceive a certain situation could determine how we have a general overview of life, and in this instance, the quality of life. So we came in, we consented. After receiving the consent, we looked at their blood pressure, were able to take their weight. That was also part of the questions we were asking. We also wanted to look at the health profile of the elderly individuals. So we had many indicators. We used a tool that is specific for the elderly individuals, and we adopted it for our Ugandan setup.
The researcher also observed that many of these elderly persons offer social support to orphaned and non-orphaned grandchildren, which leaves them economically dependent and struggling to meet health costs when plagued by disease.
Bali mu mbeera embi kuba nti n'abaana babatundako ebintu byabwe ate bwe bazze ne bafuna abazzukulu ate abazzukulu bajja nga baagala n'akabaana ke baalekawo nako bakatwala bakadde basigale mu bbanga bo bambi bali mu mbeera mbi abasinga wadde nga tulinawo abali obulungi naye be batono nnyo enamba esinga eri bubi.
I remember in one of the interviews, some of the older persons mentioned they're told eat a balanced meal. They can't afford 500 shillings to buy themselves an egg. They are told take some milk. Unless they have cows, they can't afford to take milk. Before they worked so hard for their children to be able to survive, but now they cannot work anymore. But even the people who should try and give them something, the best they do is leave them with their grandchildren.
Overall, the study revealed that the elderly in Uganda face a troop of challenges ranging from loneliness, inadequate financial support, poor housing, and ill health. These negatively affect their quality of life and consequently their perceptions and attitudes towards aging.
They had negative perceptions towards the aging process because they felt, age has taken away their livelihood. Age has taken away their ability to fend for themselves. Age has made them dependent on their children, those who have children, or dependent on people around to give them something to eat.
For improved quality of life and positive aging perceptions to occur, Dr. Onoria and Ms. Keberunji recommend increased financial help from the government and more community-based studies to enhance the understanding of barriers to improving older persons' quality of life.
We need to work together as, if we're going to inform policy, we need to work together as the health sector, the gender sector, the office working on the elderly individuals. We need to work together to see what can we do together to boost the quality of life, not just through just the improving perceptions, but what can realistically be done. Because some of the things we're talking about, the lack of finances, the lack of livelihood activities, you don't have to give them the money alone, yes, but let them have activities that they can do together. That will be very helpful, that will be very impactful, and it's more reason to do more research among the older individuals and improve their quality of life.